A very good evening to all of you. All those who are working at grassroots level to make a difference, and all those who've come from far-off lands to serve the poor in my country. Now, it's not easy to give a keynote speech. It's the end of the day, everyone's tired, and I'm sure you'd sooner have your dinner in a glass of wine rather than listen to more boring speeches. So I thought, if I have to speak, let me make it interesting. And the only way I can make it interesting is by talking of things that interest me. One of them is innovation, and the other is sustainability and going to scale. Now, when I joined the medical school in the 70s, my professor would say, if you have your finger on the pulse, you can identify the missed beat. And that, in a nutshell, is what innovation is all about. You try and find out what are the needs, what are the gaps, find simple, low-cost, local and sustainable solutions, and that is innovation. Now, it's not easy to do so, because there is no one size that fits everybody. There are different people, different geographies, and in one geography there are different cultures, and one culture spread over so many geographies. But if you want to serve the people, you understand the people. And from this understanding, the innovation will come out. I'll give you an example. We started work in Asha, we were treating tuberculosis. We had a huge number of patients, and these were in Muradabad, and those who know Muradabad, they have the brass workers' factories, and they do cutting and polishing brass by hand. There's so much dust, the lungs are choked, and TB is rampant. But that is the area where the workers refused to take our medicine. They said it's against our religion. So what we did, we connected with the religious leaders. We made them announce from the Friday's prayers that Operation Asha's medicine is not just to treat TB, it's for community upliftment. You get education, you get food for the family, you get your jobs, and everything is better if you take the medicine. And believe it or not, that is one of our most successful programs. And we went to Cambodia, 2010, and we thought, oh, Cambodia, another country like India. But when we reached the Mekong Delta, there were islands separated by water. So in India, where we have the gali gali pan ki dukan concept, in urban slums, patients are, the TB treatment centers are opened in temples and small shops. So no one has to miss work and wages in order to get the medicine. But in Mekong Delta, patients are far away. So the health provider goes on a boat, carrying the bicycle and the backpack of medicine on the boat. She rows to an island, gets on the bicycle, goes to the patient's house, gets on the bicycle, back to the boat, and to the next island. In the tribal areas of Madhya Pradesh, I have my foot soldiers of Operation Asha, and they walk through dense foliage, and there are certain shallow rivulets. So in order to preserve their shoes, and shoes are costly for health workers, for all of us, I would say, they take off their shoes and sling them around their shoulders, and they wade through streams to reach the disadvantaged. And this is what innovation is all about. And what else is innovation? The ability to work with less resources. I was just seeing before I entered the VisionSpring model for eye testing, and I thought, oh my goodness, patients in Delhi and in other big cities, they'll go to a private hospital, they'll get a card made for 500 rupees, then they'll pay for the testing. But this test can be done by any health worker who's, well, barely able to read or write. So what I'm trying to say is one doesn't need to have expensive solutions. Something that's simple will work just as well and maybe better. Well, those who've been to the Smithsonian would have seen the aeroplane made by Wright brothers, and that was powered by their own bicycle machinery. And I think that was one of the earliest examples of innovations. But to get back to the medical field, you all must have heard of hernias. And sometimes what doctors do, rather that's routinely done now, is to put a mesh in hernias. A mesh is a nylon network. If there is a gap in the muscles, that is stitched in place. But believe it or not, surgeons in India have done lakhs and lakhs of surgeries, not using a mesh that costs $500, but a piece of nylon mosquito net, the ordinary machardani that costs 2 paisa, the little piece. And the results have been outstanding. And this is innovation. Another thing about innovation, well, we all must realize we have to change with the times. Now, I cannot say, oh, I was such a great student and did so much and rest on my laurels. The ability to change with the times and change according to the changing times is the hallmark of an innovator. I was reading a book by Somerset Maugham, The Moon and Sixpence, one of my favorite authors, and he writes about a poet, George Crabbe. George Crabbe would write beautiful poetry, moral poetry in rhymed couplets, beautifully structured. He was very popular, his books would sell. But then the new poets came on the scene. There was Wordsworth, and his poetry touched the heart. There was P.B. Shelley, ethereal, Keats, flights of fancy. And these poems would tug at your heartstrings. And people lost interest in Crabbe. But Crabbe continued to write the same style, though he was perceived as being, well, heavy, ponderous, artificial, contrived. And who's heard of Crabbe today? It's all over and done with. So in order to survive, one has to innovate. In fact, when in Operation Asha, we started with TB treatment, we thought, let us track every dose taken. TB treatment is long and tedious. It takes 6 months, and if patients stop treatment halfway, they miss their doses, they get MDR TB. So we partnered with Microsoft Research to develop the e-compliance, the fingerprint device. So every dose by every patient is tracked by a fingerprint. If the patient misses a dose, we get a message alert. The health worker goes to the patient's house, repeats the education, brings them back into the system, takes the fingerprint as proof of visit, takes a cash incentive for going to the patient's house. Now, the same project, the same e-compliance was used by Microsoft Research for another NGO in Bangalore for tracking sex workers. This was 2009, and the organization has died a natural death. We don't know what happened and what was done to the project. Before I run out of time, let me talk to the next, on the next point, and that is going to scale. Now, that's very important because there's no point treating 5 patients. There is so much need, we have to go to scale. And to scale, we need certain basics. We need funds, the vision, the passion, and, well, standard operating procedures people talk about, and so on and so forth. But I'll touch on a few points. A very important need before you go to scale is to minimize your costs. A low-cost operation can go to scale. A cost-intensive operation will never scale. Resources are limited, work is unlimited. In Operation Asha, we treat a TB patient for $80. We are 20 times more cost-effective than our nearest competitor. So for the same amount of money, we can treat 20 times patients. And if I were to say that my cost of detecting TB is $27, and NGOs funded by the TB Reach, they spend $852, then I can go to the donors and say, if you pick up my model, there are 3 million undiagnosed TB patients in the world. The world's economy will save $2 billion. So what I'm trying to say is that numbers matter and mathematics matter, especially when talks to donors. And let us discuss the donor perspective. Now, the donors do want to fulfill an immediate need. Safe water is a need. You have to dig wells in Ethiopia. You have to treat patients. You have to treat cancer. You have to provide the gift of sight. All these are immediate needs. But what does the donor want with the money he is given? The donor wants a measurable impact. The donor wants results and outcome. Nobody can keep pouring money into a bottomless pit. So if I say in Operation Asha, there is total accountability and transparency. It's a low-cost, scalable, replicable, high-impact model that gives a social return of investment of 3,217%. And then if I say that with this amount of money, I have total transparency, you come and do your audits, we are doing our audits, then they know that there is no fudging of data because of the technology, and like Mr. Batra spoke before me, that there is no misappropriation of funds that is going on, and that is very important. And of course, one has to be specific in dealing with donors. I know many people who talk, they are running their own NGOs, and they talk in a very vague manner, and they'll come and say, I'm trying to eradicate poverty. So how are you doing it, gentlemen? How many people have you uplifted out of poverty? What is the economic gain? How many children are going to school? Has anything happened? Tell us your numbers, tell us the results. And they don't have the results. And this is one thing that does not work in the long run. So vague missions don't work, and actually we have to move from rhetoric to action. Everyone has to talk, but ultimately it's action and results that matter. A word about technology. Technology is a very big enabler for scaling because, obvious reasons, you have a measurable impact with technology, you can lower your costs, you can have accuracy of data, everything that is needed. Another important thing when we go to scale is to think of local people. So the mantra of the day is to think global, but you work with the local people. Now, I cannot train people in New Delhi and send them to do TB treatment in the mines of Johannesburg in South Africa. It'll have to be a local program. Somebody who's sitting there, living there, speaking the same language, eating the same food, visiting the same religious temple or whatever. That person is best equipped to fulfill the needs of the people. One can give directions from another country, but not do the work in another country. And this is why NGOs are important. Governments, with all their infrastructure, and it's excellent infrastructure the government has provided in certain aspects, but they cannot provide the last mile delivery which NGOs can. And this is how I think it is very important to keep these facts in mind when we go to scale. A sense of humility at a personal level, because that is what makes you learn from others. And actually, it's arrogance that brings about the downfall, whether it's individuals or organizations. And the last thing to mention is difficulties. I think life is full of difficulties for all of us at a personal level, NGO level, professional level. We all have financial problems, we have family problems, we have elderly people who are sick, where loans have to be paid, the boss is always grumpy, we don't have money to pay the salaries after 6 months, what are we to do? And those we love, they never seem to love us back. But with all these difficulties, if you find, you have made a difference in the lives of a lot of people. Really, it matters. An amputee is walking with the help of the Jaipur foot. A bedridden TB patient has got his job back and is feeding the family. Someone who wasn't able to pick up a paper, see a single word, he's going to college because he's got glasses. A lady for whom the world is a blur. Today she can see the sky, she can see the trees bursting into leaf. And these are things that keep us going and give us strength.